Hello, my name is McKenna Abercrombie, and I am a first-year dermatology resident at St. Joseph Mercy Hospital. Today, I will be presenting our QI project, which utilized a pre-operative phone call to surgical dermatology patients in efforts of more fully informing them of the procedure and giving a dedicated opportunity to ask questions. Patient satisfaction is an increasingly important aspect of clinical medicine, both ethically and in regard to new reimbursement models. Dermatologic surgical procedures can provoke anxiety and uncertainty for patients as they are often unfamiliar with the procedure being performed and the post-surgical expectations. Furthermore, many dermatologic surgeries are performed in cosmetically sensitive areas like the face, and patients have appropriate concern for cosmetic disfigurement. Physician phone calls to patients prior to the procedure may provide a simple intervention for improving a patient's understanding of the procedure, reducing anxiety, and improving satisfaction. Although not evaluated by this project, this intervention may also have the potential to limit adverse events. The potential benefits of having physicians call patients are numerous. This provides an opportunity for patients' education, stress reduction, question answering, and more. It also provides a key opportunity for physicians to specifically address more intricate pre-procedural recommendations regarding the preoperative management of a patient's medications, including antibiotics and anticoagulants. However, phone calls to patients made by physicians can be impressively time-consuming, as patients often have several questions. In addition, as well as with all clinical communication, care must be taken to avoid miscommunications and ensure patient understanding. The purpose of our project was to design an informational phone call which would be made to patients the night before their dermatologic surgery. We hypothesized that these patients would report increased satisfaction and lower anxiety with their procedure as compared to patients who did not receive the phone call. The patients selected for this project included all surgical patients at the academic dermatology clinic during the study period. Patients included those presenting for both standard excisions and Mohs micrographic surgery. Approximately half of patients were designated into the control group and did not receive a pre-surgical phone call. The other half were designated into the experimental group and did receive the pre-surgical phone call. Figure 1 demonstrates the pre-surgical phone call script that was discussed verbatim with all patients in the experimental group. Relevant topics included the continuation of anticoagulants, pain expectations, anesthesia plans, appointment length, and post-operative healing. Figure 2 displays the post-operative survey with Likert scale answer choices given to all patients included in the control and experimental groups. 1. Overall, how satisfied are you with your recent surgical experience? 2. Were your questions adequately addressed prior to your surgery? 3. How prepared did you feel for your procedure and after procedural care? 4. How would you rate your level of fear, apprehension, or anxiety prior to your surgery? 5. How would you rate your experience during your surgery? And 6. Did you receive a phone call from your resident surgeon the day prior to your surgery? There were 26 patients in the control group and 61 patients in the interventional group who completed the voluntary survey. Patients in the experimental group reported higher rates of overall satisfaction, satisfaction with answers to questions, overall preparation, and overall rating of surgical experience, while also reporting lower levels of fear and anxiety. Of these findings, differences in the level of preparedness were statistically significant. In conclusion, patients who received a pre-surgical phone call had a significantly higher rate of preparedness for their surgical procedure. There were trends towards higher levels of all other endpoints measured, and larger group sizes may further clarify these differences. Also, pre-surgical phone calls from a provider may help to improve patient satisfaction. Further direction of study may evaluate the implication of these phone calls on adverse events, to include pre-surgical antibiotics and post-operative infections, as well as anticoagulation and postoperative thromboses. Limitations to our study include reduced patient clinic load during experimental phase due to the COVID-19 virus, and also recall limitations. We would like to acknowledge the academic dermatology clinic staff and our fellow St. Joseph Mercy dermatology residents. Here are our references, and I thank you for your time and attention.